Right. Good evening once again. So it's time to start our OET speaking class. So as I promised last week, and also just said it yesterday as well, I'm gonna start with the mock test that who didn't participate last week. Last week එකේ mock test එකට එන්න බැරි වෙච්ච කට්ටියට තමයි මම chance එක දෙනවා කියලා කිව්වේ මුලින්ම. එතකොට ඒක මේ මම නම කියන්න මම ස්ක්‍රීන්ෂොට් එකක් ගහගෙන තියෙන්නේ right මගේ ස්ක්‍රීන්ෂොට් එකේ පිළිවෙලට තමයි මම ඔයගොල්ලන්ගේ නම් කතා කරන්නේ මේගොල්ලෝ ඉන්නෝ නම් එයාලට පුළුවන් මොක් ටෙස්ට් එකට එන්න හරි ඒ පිළිවෙලට තමයි ගන්න ඒක ඉවරුනාට පස්සේ මම හැමෝටම ආපහු කමන්ලි දෙනවා කතා කරන්න එතකොට අපි මොක් ටෙස්ට් එකට ගන්න අපි ලාස්ට් වීක් එකේ එකමයි හරි ගොඩාක් ටයිම් එක වේස්ට් කරන්නේ නැතුව අපි මේකෙන් පටන් ගමු මොකද ගොඩක් කට්ටිය ඉන්නවා එතනත් ගන්න ඒ නිසා පුළුවන් තරම් ඉක්මනට ගන්න ඕනේ නිසා හරි right එතකොට මම මුලින්ම නම තමයි ඔයගොල්ලන්ට කතා කරන්නේ මේ නම තියෙන අය ක්ලාස් එකේ ඉන්නවා නම් ඒගොල්ලන්ට මයික් එක ඔන් කරලා කතා කරන්න පුළුවන් okay right right ඉස්සල්ලාම අපේ තනෝජා මිස් ඉන්නේ තනෝජා මිස් නම් ඇවිල්ලා ඉන්නේ right
ඇවිල්ලා ඉන්නේ.
ඇවිල්ලා ඉන්නේ okay miss Tanuja right miss we can start now
Good evening. I am Tanuja. I am one of the registrars on duty today. I am going to take in care of you today. First of all, for the document confirmation, can you tell me your full name, please?
yeah I'm Sachitra you can call me as Sachi
Okay. Thank you very much for your cooperation. You seem very uncomfortable today. Can you tell me what's bothering you?
yeah actually I'm having a severe headache So I'm here to take a medicine for that.
I am really sorry about that. If you don't mind, I need to ask some questions to get a detailed understanding of your condition. Is that okay with you?
Yeah, sure.
Okay. First of all, can you tell me how do you get your headache? I mean, it uh, comes from just one side or both sides?
There's only one side. So now this moment I have the right side pain.
Okay. Next, Sachi, could you please tell me how the severity of the pain? If your pain on a scale 1 to 10, 1 is the lowest and 10 is the worst, can you rate it?
Yeah, I would say like it's 10 because it's so severe now.
Oh, I'm sorry to hear that it's so high. I understand that it's hard to bear. I'm especially concerned about that, okay?
Yeah.
Okay, Saji. In addition to that, could you please tell me, is it a throbbing pain or dull or sharp pain?
It's actually a throbbing pain. It's really serious this time.
Okay. Next, could you tell me, please, is this happen the first time or is it happened before?
It's not actually the first time. So it was all started like 2, 3 weeks before.
Okay. Okay, Sachi. As you say so far, the headache started. Uh, uh, I think I didn't ask about that. Can you please tell me when did the headache start?
Yeah, I can't remember exactly the date, but it was like 2 weeks back.
Okay, 2 weeks back, no? So, Sachi, as you say far, uh, you said your headache start 2 weeks before and it's come from one side normally and it's a throbbing pain. Am
Yes.
I okay with you?
Yes, that's correct.
Okay. Uh, Next, Saji, please, can you tell me uh, any other problems associated with the pain, such as dizziness or nausea or
It
vomiting?
always, yeah, it always accompanied with nausea and vomiting.
Okay. And next, could you please tell me um, anything relieves your pain? I mean, anything reduce your pain?
Normally, I'd like, yeah. So, yeah, I'd like to take some paracetamol. So it would answer. Most of the time, it would answer the paracetamol, but these days it's not the same. So I prefer to have a strong painkiller from you. That's why I'm here. And I must say that I'm really in a hurry to go to my meeting as I'm so busy today. So if you can give me a strong painkiller as much as possible, so that's really helpful for me, please.
Okay, Saji, I understand your situation. But the problem is at the moment, doctor is in emergency situation. So let's talk about later. And I have to ask some more questions about get uh, more details about your
Right.
condition.
Okay, Ms. Tanuja, that is the end of the time then. Thank you very much for participating.
Thank you, Miss.
You're welcome. මම ඊළඟ කෙනාගේ නේම් එක කතා කරන්න මෙයා ඉන්නවද කියලා බලන්න මෙයාට ලකුණු දෙන ගමන් ඊළඟට අපේ NS රත්නායක මිස් ඉන්නවද NS රත්නායක
Yes.
Yes, right. You're going to be the second person today to do the mock test. I'm going to give the chance for you. Let me have 1 minute, miss, okay? Yes. Right. Right, Ratnayaka miss, if you're ready, we can start now.
Yes, ma'am.
Yes, you can start.
Hello, good morning. My name is Ratnaik and I am the nurse in emergency department on duty today. For the documentation purpose, could you tell me your full name, please?
My full name is Sachitra, so you can call me as Sachi.
Okay, Miss Sachi, you seem distressed. Please let me know how can I assist you?
Yeah, I'm suffering from a severe headache now this time. So if you can give a painkiller or a strong injection, that would really help me to alleviate the pain. And also, I need to tell that I'm in a hurry to go for a meeting. So if you can be very quick in sense, that's really helpful for me, please.
Okay, Miss Saji, I can understand your situation. I hope you don't mind that before prescribe any medication, I need to know more about headache. Uh, uh, if it is doesn't mind, may I ask you some questions?
Sure.
First of all, I want to know when the headache start.
It was actually, I can't remember exactly the date, but I'm sure that was like 2 weeks before.
2 weeks before. Then, is this first time or you have had them before?
Yeah. So yeah, it was all started like 2 weeks before, and I have had regular episodes.
Mm, is the pain on just one side on the head?
No, actually, yeah, I'm sorry. Yes, that's from the right side.
Right side. Okay. Could you tell me how severe the pain is on pain scale of 0 to 10? 0 is no pain, 10 be worse too. Have you ever experienced?
I would say 10, and that's really painful.
Or you are going through severe pain? That must be really difficult to cope you. Could you describe your headache? I mean, is it throbbing pain, dull or sharp pain?
It's a throbbing pain, actually. Yes.
Throbbing pain. Mm, do you have any symptoms? Maybe some nausea, vomiting, dizziness, blood vision.
Yeah, it's most of time it's accompanied with nausea. Yes.
Okay, Miss Sachi, finally, I want to know, you feel anything is triggering you for having this headache?
Yeah, so basically the sunlight and the loud noises make it worse.
Okay, Miss Sachi, to reiterate what we have discussed, that your headache getting started 2 weeks before, and you have had throbbing pain, and your pain level is 10, and you have nausea. Am I correct, so far?
Yes, it is.
Mm, especially, I want to suggest a few things which you told some triggering point makes the pain much worse. If you can cutting down the triggering points, you can mitigate your headache. Can you understand what I'm saying?
Yeah, I can understand.
Then let's talk about the type of the work that you're doing because that's really important to know. So, could you like to tell me in profession what are you?
In profession, I'm a marketing director.
Oh, that sounds stressful job that you for answering thank you for answering my question. And this is my last question, Miss Sachi. Before you are having severe pain past week, and how could you alleviate this pain?
Yeah, sometimes I'd like to take 2 hours sleep, so that normally alleviate my pain. And also sometimes I used to take some oral medications, I mean like over-the-counter medications like paracetamol. So it have answered sometimes, but these days it's not. So thank you very much for participating, Ms. Ratnayaka. That is the end of the time.
Thank you.
You're welcome.
You, Pata.
Yeah, give me 1 minute. Right. And so we'll see who's the next person. Imalka Prematunga.
Yes.
Yes. Yes, Imalka is there. Right, Miss Imalka, we can start now.
Good morning. My name is Simalka, and I will be your attending nurse today. For the document purposes, may I know your name, please?
You can call me as Sachi.
Okay, thank you, Sachi. You seem distressed, Miss Sachi. Please let me know how can I assist you?
Actually, I'm suffering from a severe headache these days, actually. So it's really bad. And I need to have some strong painkiller or injection. So if you can give it to me as soon as possible that you can, that's really helpful because I'm in a hurry to go for a meeting in 15 minutes. So I need your help, please.
Okay, I can understand your situation, but I hope you don't mind that before prescribing medication, I ask some questions about from you before prescribe medication. May I do that?
Sure.
Okay, thank you. So is the pain? When did the pain start?
Um, all these pains have started like 2 weeks before.
2 weeks. Okay. So is the pain on just one side or on the forehead?
Just only one side, actually. It's the right side.
Okay. And how severe is the pain? On a scale of 1 to 10, that 1 is the lowest pain and 10 is the worst, according to your experience?
I would say 10 for that.
Okay. That must be really difficult to cope with. Could you tell me if it is a throbbing pain or dull or any sharp pain?
It's a throbbing pain. It's really painful.
Okay. Is this the first time?
No, that was not a first time. So as I said, it was all started like 2 weeks before. So from then, I have had like several episodes.
Okay, it's all right. Is the pain accompanied by any other symptoms?
Yeah. So most of the time, it comes with nausea.
Okay. Okay, is there anything alleviate your pain?
Yeah, actually, I used to have like if the headache comes when I'm at home, so I usually take like 1 or 2 hours sleep. That really alleviate my pain, and I used to have like paracetamol.
Okay. Could you tell me if anything triggers your pain?
Yeah, sometimes the sunlight which comes from the window of my office that really trigger my headache.
Okay, sure, sure. So far, I understood that your pain started at 2 weeks ago, and it is on the right side on your head. And It is accompanied by nausea. Then it alleviate with 1 and 2 hours of sleep and taking some paracetamol. And it is triggers with the sunlight. Okay, Papa, is that right, Miss Sachi?
Yeah, that's correct.
Yeah, thank you. And for the clarification of your diagnosis, let's talk about your profession. Could you tell me what kind of work you do?
Actually, in profession, I'm a marketing director.
Mhm. And how many hours do you work?
Yeah, usually I have to work like 8 hours, but these days I'm doing overtime.
Okay, that sounds stressful. All right, based on our consultation today, your symptoms are consistent with my claim. And you can see a doctor here in 30 minutes time, about 30 minutes time, who will be able to prescribe medicine and confirm the diagnosis. Is it okay, Sach?
Yep, that's all fine with me. So that is the end of the time, Miss Himalka. Thank you very much for participating.
Thank you.
Right, and then we move on to the other person. Who's the next? H.K. Samaranayaka. See no other. H.K. Samaranayaka. Miss in no other. Right. Samaranayaka Miss නැහැ. Udesha Kalupahana. Miss.
Yes, ma'am.
Yes, see no, right, okay. So Miss Udesha, we can start now.
Hello, good morning. My name is Subesha and I'll be attending us in this accident and emergency unit. How may I?
Call me Sachi, please.
Okay, Sachi, I can see that you seem distressed. How can I assist you?
I actually have a severe headache, so that's actually from the right side of my head. That's a really severe pain. So if you can give me a strong painkiller or injection, that would really help me, please.
I can understand your situation. First of all, I need to ask you some questions regarding your headache before prescribing a medication. Is that okay with you?
Sure, yeah.
Could you please explain what kind of pain you have experienced?
Um, if I have to say the pain, the type of the pain, actually, it's a very serious, very severe pain.
Okay, Ms. Sachi, would you mind telling me how severe the pain is on a scale of 0 to 10? Here, 0 is no pain and 10 being the worst you have ever experienced.
I would say 10 for that. It's so severe.
Oh, I am so sorry to hear that. Your pain level is so high. Could you tell me if the pain is throbbing pain, dull, or sharp pain?
It's a throbbing pain, yes.
Okay, Saji. Is this first time or you have had them before?
I have had them before, actually. Yes, it was all started like 2 or 3 weeks before. Can't remember exactly what was the date, but I have had severe like several episodes for 1 week. So this is not the first time.
Okay. Did you get pain medication to control your pain earlier?
I did take some paracetamol, and that's the only thing I took.
Okay. Is your pain accompanied by Any other symptoms such as nausea, vomiting, dizziness, like that?
Most of the time with nausea, I would say. Yeah. And dizziness as well.
Okay. Is there anything that alleviates your pain?
Mm, uh, like sleeping?
Okay. Thank you for answering my question. Let me ensure that you told me that you have headache and it is a throbbing pain and you told me also it have had 2 or 3 weeks before and you told me that also you have get paracetamol to control your pain. Um, um, is there anything to tell me?
Yeah, actually. So if you can give me the painkiller as soon as possible that you can, because I'm in a hurry to go for my meeting in just 15 minutes. So if you can give me even an injection would help me, I guess.
Okay, Saji, could you please tell me what kind of work do you?
So in profession, I'm a marketing director.
All right. How many hours do you work?
Basically I work like 8 hours, but these days I do overtime.
Oh, I understand your stressful situation and how your symptoms may be cope with that pain. According to your symptoms, it may be migraine. The doctor will come within 30 minutes and he will be able to confirm the diagnosis and prescribe some medication. Is that sound okay with you?
Right, that is the end of the time, Miss Sudesha. Thank you very much for participating.
Thank you.
Right. ඊළඟට RNW පතිරණගේ. Miss or Mr.
Hello,
RNW
Miss.
පතිරණ. Yes.
Hello, Miss.
Yes, you are there. Okay, so just give me
Hello.
one. Yeah, give me 1 second just to write your name.
Okay, Miss.
Right. Okay, Miss, you can start now.
Good morning. My name is Rajita Pathiranage. I'm one of the registered nurse in this accident and emergency unit. May I confirm your ID details with you? Please confirm your first and last name for me.
So my first name is Sachitra and my last name is Madhushani, so you can call me Sachi.
Thank you, Miss Sachi. I can see that seem distress. Would you mind telling me what the problem is?
Actually having a severe headache. So it's just only the right side of my head, and that's so severe. I can't bear it. I can't concentrate on the work as well. So I may like to have a strong painkiller for this one, please, because I need to head on to my meeting in 15 minutes. I'm in a really hurry to go there. So if you can give me a strong painkiller, a injection, that doesn't matter actually. So just I need to alleviate the pain, please.
Okay, Miss Sachi, I can understand your condition. Before further proceeding, I'd like to ask you some questions about your headache. Is that all right?
Yeah, sure.
So, is the pain on just one side of the head or both sides?
Just only the one side, right side.
Okay. Okay, Miss Sachi, could you tell me how severe the pain? The pain is on a pain scale of 0 to 10 here. 0 is no pain and 10 is worse.
Like 9.
Okay, I'm sorry here to that. Your pain level is so high. Could you mind tell me if it is a throbbing pain or dull or sharp pain?
It's like throbbing pain.
I can see that this has been very difficult for you. Is the first time or you have had them before?
No, actually, the first times I have had these headaches like around 3 weeks now. It's so serious. I mean, like when I'm having the headaches, I can't concentrate on whatever I'm doing.
Okay. And during this episode, how long did the pain last?
Like around um more than 1 hour actually, yes.
Okay. Could you tell me, is there anything that reduces your pain?
So which asking is whether I'm taking any medications.
What the medication?
I didn't take any medications for this one. No, I didn't take because I thought that this is something normal. I don't like to take no medication, so I just took like 1 or 2 hours sleep. So that would actually help me to get alleviated the pain. But so now I can't do that because as I said, I need to head on to my meeting, so I need something strong.
Okay, I understand your condition. Please, could you tell me if anything was your pain?
Basically the sunlight makes more worse.
Sorry,
Sunlight. Yes, the sunlight
sorry.
comes through my window makes it so worse.
Okay, okay, Miss Sati, is the pain accompanied by any other problems?
Yeah, like I have dizziness and nausea.
Okay, all right. And how many hours do you work? And
No, like 8 hours.
okay, could you tell me what kind of work you do?
Yeah, in Mauritian, I'm a marketing director.
Okay, that sounds stressful. Thank you for answering my questions. Here's what I have understand. You have had severe headache on right side of your head, and it's first time. It starts since start for 3 weeks ago, and it's was in sunlight with sunlight and reduce with sleep. It's accompanied with nausea. Is that an accurate summary?
Yeah, that is. Right. So, Miss President, again, that was the end of the time actually. So, thank you very much for participating then.
Thank you, Miss.
You're welcome. Mm. Who's the next one? WMA Karunaratna. Miss Inad. No? Again, WMA Karunaratna. Nee. Right. Enang Ishani Anuradi Alaha Kon Miss.
Yes, miss.
Yes, you are there. Right. Okay, Miss Ishani, I'm going to give the chance for you. Let me have 1 second to write your name. Right. Okay, Miss, we can start now.
Okay. Good morning. My name is Ishani and I will be your attending nurse today.
Mhm.
First of all, I want to confirm your ID details with you. May I know your full name, please?
Yeah, actually, I'm Sachitra Madhushani, and you can call me as Sachi.
Thank you. You seem distressed, Miss Sachi. May I know what's bothering you?
Yeah, actually, I have a severe pain, severe headache, actually. So that is just only the right side of my head. But so if you can give me something stronger to get alleviate this pain, that's really helpful. And I would need to mention that I'm in a hurry to go for a meeting. So even though it doesn't matter if you can give an injection or something.
Definitely, Miss Sachi. But before that, shall I ask you a few questions from you? Is that okay with you?
Oh, yeah.
Okay. Could you please tell me about your pain? Is the pain on just one side of the head or both
Yes,
sides?
just only the right side of my head.
Oh, would you mind telling me how severe the pain is on a scale of 0 to 10? 0 is no pain and 10 is the worst.
It's like 10, it's just worse. Yeah.
Oh, that's a pity. Your pain is really high. I know it's really difficult to cope with the pain. Additionally, could you please tell me about the pain type? I mean, if it is a dull pain, sharp or throbbing pain?
It's like a throbbing pain, I would say yes.
Okay. Is this the first time you have experienced this headache or
Yeah,
you have
actually,
had this before?
yeah, actually, yeah, I have had this before, like 2 or 3 weeks before, yeah. Have
Oh,
that episodic, yes.
oh, oh. What you're saying is that your headache was happened 3 weeks before and your 2 episodic attacks also are occurring every week,
Yeah,
right?
yes,
Do you
yes.
think, do you think is this pain accompanied triggering point? I mean, accompanied by other problems you have? I mean, dizziness or nausea or like symptoms?
Yeah, actually, I have noticed that it comes with the dizziness and nausea sometimes.
Okay, Miss Sachi. Besides this, may I know your occupation? How many hours you do work usually?
So in that sense, I'm a marketing director, and I work like basically 8 hours for my company. But these days, like it's not there 8 hours because I need to do overtime because I'm working for a deadline of a project.
Okay, that sounds very stressful. Based on our consultation today, let me briefly explain your condition. Actually, according to my knowledge, your symptoms are consistent with migraine, but only a doctor can confirm the diagnosis and also prescribe medication. Uh, you can see a doctor in 30 minutes, Miss Sachi. Can you wait?
As I said before, I'm in a really hurry to go for my meetings. Unfortunately, I can't wait another like 15 or 10 minutes either. I'm so sorry for that. If you can give her just a painkiller, I'm asking. So I know that maybe sometimes make rain out. Something else. For now, just I need a painkiller.
Oh, I can understand your situation, Miss Sachi. I know it's difficult to cope with the pain, but it's beyond my scope to change the drugs without doctor's prescription, actually. Your safety is my priority. But actually, your I want to suggest few things about the condition. It's better if you can get expert opinion about your condition at this stage. If you don't seek right treatment, you will experience severe pain in the future. So it will interfere your working situation as well. Therefore, it's better you consult a doctor today and get the right medication, Ms. Saji. Since you have a stressful job, there is a possibility that stress is triggering the headache. So could you try to postpone your could you try to wait, please, for the
Yeah,
doctor's.
okay. So thank you very much, Mrs. Shani. That was the end of the time. Thank you very
Thank you,
much for
miss. Thank you.
participating. Uh, right. Next chance goes to AVM Ranjani, Miss Inada.
Yes, miss. Yes,
Right?
miss.
Very good. Yeah, Miss, you can start now.
Okay, miss. Thank you. Good morning. I am Ranjini. I am one of the registered nurse in this hospital. How may I address you?
Oh, Miss Sachi, please.
Okay, Miss Sachi. You seem distressed. Let me know how can I assist.
Yeah, actually, I'm having a severe headache. So if you can give a strong painkiller for me, that's really helpful for me.
Okay, I can understand your situation, miss. That's terrible. I need to ask some question regarding your headache before prescribing. May I do that?
Yeah, sure.
Okay. Uh, is your headache one side or both side? Can you explain that?
Yeah, it's actually just only the right side of my head. I wonder why it is, but just only the right side.
Okay, Miss Sachi. Uh, can you explain your headache according to your severity? Uh, according to a pain scale, 0 is the no pain, 10 is the worst pain. Can you explain about this pain?
Yeah, it's like 10, I would say. It's really, really painful.
Okay, is that throbbing pain or dull pain or
It's a
sharp
throbbing
pain?
pain. It's a throbbing pain.
Oh, that's terrible. That you can't cope with your pain. It is difficult to cope with your pain. Okay, Miss Sachi, have you had have you had your headache before? Uh, you have
Yeah,
any
actually,
experience?
yeah, I have had this before, which means like it was all started like I can't remember exactly, but it's 3 or 2 weeks, but however, it's like more than 2 weeks. Yeah. So I have had several episodes.
Okay, Miss Sachi. Have you had any medication for your headache?
Um, no, actually, not from the hospital. I just took some paracetamol.
Okay. Is the pain accompanied with any symptoms regarding that uh, nausea, vomiting?
Yeah.
Okay. Can you tell me about how is your work? What do you work?
I work as yeah. So in profession, I'm actually a marketing director.
Okay, how many hours do you work?
Like around 8 hours, but these days I do overtime.
Oh, that sounds stressful. Based on our consultation, I think you are suffering from migraine. It is better to meet our doctor. Can you wait for 30 minutes for see your doctor?
No, actually, no. As I said before, I'm in a hurry to go for my meet in 15 minutes. So I can't wait another 10 or 15 minutes here. That's a waste of my time, actually. So if you can I'm just asking a painkiller. I know that it would be migraine or something else, but I just need a painkiller. Oh, if you can give me an injection, I guess that's a quick response.
Okay, Miss Sachi, I can understand your situation, but you want to meet the doctor. He diagnosed your headache and he prescribed you any medication.
Uh-huh.
So you want to stay with wait for the doctor. It is better to uh, alleviate your headache after giving medication, doctor. Please, can you wait for another 30 minutes? I
Okay,
apologize
that
you.
is the end, Miss Ranjani. Thank you very much for participating.
Okay, thank you, Miss.
Welcome. Mm, mm. Right. So next chance goes to Miss Dinesha Manori. Miss Dinesh K.A. Dinesha Manori. Right. Miss Navage. If not, the chance goes to Miss Udeshika Kumari. Miss Udeshika Kumari. S.T. Udeshika Kumari. මම හිතන්නේ මිස් මට මැසේජ් එකකුත් දාලා තිබුණා. මේ ටිකට නැද්ද? K.A. Dinesha Manori ඉන්නවද? නෑ. ඊට පස්සේ කවුද මන් දැන් කිව්වේ? S.T. Udeshika Kumari.
Yes, miss, I'm here.
Yes. It's your chance now. Just let me have 1 minute, please.
Okay.
You already there were in the list.
Okay,
Right.
thank you.
Yeah. So yeah, we can start now, miss.
Good morning, I'm Udeshika. I'm the attending nurse on duty today. For the documentation purposes, may I know your name, please?
Yeah, you can call me Sachi, please.
Okay, Miss Sachi. You seem distressed. Would you mind telling me what's bothering you?
Yeah, actually, I'm suffering from a severe headache, so that's really painful. I can't concentrate on any work. So I'm just here to ask you whether you can provide any pain relief for me. So maybe tablet or injection, whatever. And because I'm in a hurry to go for a meeting.
Oh, it's pity to hear that, Miss Sachi. But first of all, I'm going to ask you some questions regarding your condition before proceeding further. Is that all right, Miss Sachi?
Sure.
Uh, Firstly, could you please tell me, Miss Sachi, how long have you been suffering from this headache?
Um, like around 3 weeks now.
Uh-huh. Is there anything? Uh, no, is that pain in your both side of head or partially, Miss Sachi?
It's like a right side of my head actually.
Thank you for your information, Miss Sachi. Then could you please telling me how severe the pain is on a scale of 0 to 10? Here it is 0 is no pain and 10 is the worst pain.
I would say it's 10. It's so severe this time.
Oh, really, it's your pain level is so high, Miss Sachi. It's pity to hear that, and I can understand your situation. For the more information, could you please tell me, are there any triggering factors that increase your pain, such as
Mm, yeah. Yeah,
muscles?
actually, I have examined that. I've noticed that when I'm having headaches and when I'm working at my table while I'm having some headaches, so the direct sunlight comes by my window, make it worse. So I think sunlight is one triggering point.
Yeah. Then how about your work, Miss Sachi? Are there any stress? Are you under any stress at the moment?
Yeah, I say yes for that one because in profession I'm marketing director and I'm working for a deadline project these days and I do overtime and I say yes. It's really stressful these days.
See, you're saying you're under stress in these days. Is that all right, Miss Sachi? Am I correct?
Yeah. Yes.
Yes, I can understand this must be overwhelming for you, Miss Sachi. Then could you please tell me, uh, have you had any medication to mitigate your pain?
Not really. I didn't take any medications, but yeah, just to mention that I took some paracetamol sometimes, and beside that, I took sleep. Yeah.
Uh, could you please tell me, are there any symptoms with accompanied with your headache, such as vomiting, dizziness, blood vision like that?
Yeah, sometimes it's dizziness, I would say.
Okay, thank you for your information, Miss Sachi. To reiterate what we discussed today, you have had suffering from headache since 3 weeks ago, and it has, sorry, it has accompanied with vomiting, and you have had a both side of headache, and mm, and also you have not on any medication. Your
I
work
I
has.
got some sleep actually. Yeah, I slept. Yeah, like 2 or 3 hours, so that would really help me to alleviate the pain of my headache. Yeah,
Then you were in a severe pain pain. Your pain scale is 10.
yeah.
Uh, then according to your information and your symptoms, I think you are suffering from migraine, Miss Sachi. But for the proper diagnosis, you have to consult our doctor. So, but the thing is, our doctor is busy at the moment with a critically ill patient. So, could you please wait for another 30 minutes to consult our doctor?
Right. Okay. Thank you very much, Miss Sudeshika. That is the end of the time.
Thank you, Miss.
Right. The last chance goes to PTPR Vapnakulasuri.
Yes, miss.
Right.
Hello.
Yes, I can hear you. Just give me 1 minute just to write your name on my book. Right. Okay, miss, we can start now.
Hello, my name is Pamela. I'm your attending nurse today. For documentation, can you tell me your full name, please?
Yeah, I'm Sachitra Madhushani, but you can call me as Sachi, please.
Okay, Miss Sachi. You seem distressed today. Please let me know how I can help you.
Yeah, actually, I'm suffering from a severe headache. So if you can give me a painkiller, that would really help me actually.
Oh, I see. First of all, I want to ask you some question from you about your condition.
Mm-hmm.
It's really important before prescribing medication. Can you
Mm-hmm.
help that?
Yeah, sure.
So, can you tell me where your pain radiate in the head? I mean, is the pain on just one side of the head?
Yeah, actually, just the right side of my head and just above the ear.
Oh, okay. Then I want to know about severity of your pain. This scale on 1 to 10. 1 is lowest and 10 is worst. So, how you experience about pain? I mean, according to
Mm. Yeah, that's actually a good question. So I would say it's 9. It's so severe. I can't concentrate any work. That's why actually I'm here to take any kind of a medication, a strong painkiller, because I need to head on to my meeting in 15 minutes. So if I'm in this condition, I know that I can't concentrate what other people say in my meeting. So that's why I need to have a kind of a very strong painkiller, if you
yeah.
can.
Oh, I see, Miss Sachi.
Mm.
Actually, it seems to discomfort. All right. Can you tell me your pain is throbbing pain, dull or sharp pain?
I would say it's a throbbing pain.
Oh no. Then tell me more about your pain. I mean, is the first time or have you had this fear previously?
Not actually the first time. I had this pain like around 2 or 3 weeks, and in several episodic. Yeah, like 2 or 3 times for 1 week.
Oh. Then you say that this headache started 2 or 3 weeks ago.
Mm-hmm.
Am I right?
Yeah.
Hmm. And during this episode, how long did the pain last?
Um, it took like more than 1.5 hour.
Oh no.
Yeah.
I don't know how you problem with this pain.
Like dizziness.
Oh, okay. Is there anything that reduce your pain?
Sometimes I used to have like 1 or 2 hours sleep, so that's really helpful for me to get out of this headache. And sometimes I took some paracetamol.
Could you tell me if anything increase your pain?
I've noticed that sometimes the sounds, I mean, like the loud noises and some strong smells, and also sometimes the direct sunlight comes through my window to my laptop makes it worse. And also sometimes, yes, the laptop, the screens of the devices makes it worse.
Then can you tell me about what kind of work you do?
Actually, I'm in profession. I'm a marketing director.
All right. And how many hours do you work?
Basically 8 hour shift, but these days I'm doing overtime.
Oh, I see. That sounds so stressful. Uh,
Mm-hmm.
all right, Miss Sachi. Based on our consultation today,
Uh-huh.
your symptoms are likely what's a migraine.
Mm-hmm.
Do you heard what is migraine?
No, actually, no, no.
Oh no. Uh, then I will explain later what's the migraine. Then you can see a doctor here in about 30 minutes. And then you can confirm the diagnosis and then after prescribe some medication uh, from our doctor. Can you stay here for 30 minutes?
Right. Okay, Ms. Varnakala Surya, that is the end of the time of yours. Thank you very much for participating.
Thank you, Miss.
You're welcome. Right, I guess that is the end of my list. Yes. මගේ ලිස්ට් එකේ ඔයාලට පේන්නේ බ්ලර් වෙලා තියෙන්නේ නෑ පේන්නේ. මගේ ලිස්ට් එකේ ඉන්න කට්ටිය එච්චරයි. ඒගොල්ලෝ තමයි ලාස්ට් වීක් එකේ හිටිය අන්තිම වෙනකන් රේසන් කරලා ගන්න chance එක හම්බුනේ නැති නිසා තමයි I decided to give the chance. So මගේ අලුත් lesson එක එහෙම නැත්නම් අපේ අලුත් mock test එකට යන්න කලින් මේගොල්ලන්ගේ comments එක මම කියලා ඉන්න නම්. Right. I'll stop share this previous one. Okay. Right. So we have started with Miss පොඩකින් මම ඔයගලන්ගේ marks ටික දැම්මට grade එක දාලා නැහැ. එකෙන් දෙකෙන් ලකුණු මාරු වෙන නිසා මට හරියට මේක confirm කරගන්න ඕනේ. Right. මට දෙන්න විනාඩියක්. Yes. 1 minute. Right. මම හිතන්නේ විනාඩියක් ගියා කියලා. හරි. මෙන්න මෙහෙම තමයි ඔයාලගේ කමෙන්ට්ස් ටික. මිස් අනෝජා තමයි ඉස්සල්ලාම කතා කරේ. Right. Linguistic, clinical දෙපැත්තට වහම linguistic පැත්තට ගියාවහම ගොඩක් වෙලාවට මිස් කතා කරද්දී මේ එක question එකකින් ඊළඟ question එකට මාරු වෙන්න ඔයාලට ගොඩක් time එක ගන්නවා. ඒ කියන්නේ මෙහෙමයි. දැන් Q card questions වලට answer කරනකොට commonly ඔයාලා ඒ idea එක ගන්න හැමෝටම කියන්නේ මිස්ටර් සහ අනිත් අයත් අහගෙන ඉන්න. ඕකේ. ඒ කියන්නේ අපි questions අහන එක විතරක් නෙවෙයිනේ මේක කරන්න ඕන section එක. අපි ගොඩක් task cover කරන්න ඕනේ. එතකොට ගොඩක් අයට මේ මුල part එකේ ඉන්න ගොඩක් අයට last part එකට ගියන්න බැරි වුණා. ඒක හිතාමතා කරපු දෙයක්ද? නැත්තම් ඒක මදක් යනකොට කොහොමද නවත්තනවා කියලා දන්න නිසා නැවැත්තුවාද කියලා මම දන්නේ නැහැ හරියටම. නමුත් පුළුවන් තරම් try කරන්න. මොකද ගොඩක් අයට මේ අවසාන කොටසට ඒ කියන්නේ information giving part එකට ගොඩක් අයට මම දීලා තියෙන්නේ 1 mark. එක ලකුණයි මම දීලා තියෙන්නේ. එතකොට ඒකට ලකුණු හම්බ වෙන්නේ නැහැ. ඇයි? මොකද information giving part එක හිස්. කරන්න නැහැ information giving කරන්න වෙන්නේ නැහැ. සමහර parts අර පොඩි පටන් ගන්නමක් විතරයි ගොඩක් කට්ටිය ගත්තේ. ඒ නිසා ගොඩක් අයට 1 mark තමයි හම්බ වෙලා තියෙන්නේ information giving under clinical communication. ඒක ලකුණු අඩු වෙනවා. ඔයගොල්ලන් එහෙම කරොත් ඒ නිසා ගොඩ slow වෙන්නත් එපා. ගොඩ අදින්නත් එපා කතා කරද්දී. සහ ගොඩාක් මේ sorry මිච් විජේසේන මම chance එක දැන් last week එකෙත් දුන්නා ඊට කලින් week එකෙත් දුන්නා මං හිතන්නේ දැන් අදත් දුන්නා අපි මේක මේ setting එක අදින් ඉවර කරලා ඔයාලට next එකට chance එකක් ගන්න පුළුවන් okay ඔයාලා resign කරොත් ඔයාලට chance එකක් ගන්න පුළුවන් ඒ නිසා okay right එතකොට මේ ගොඩක් time එක miss අරන් තිබුණා හරි ගොඩක් ටයිම් එක අරගත්තා ඊට පස්සේ මේ pronunciation clear නමුත් වචන අර slow වැඩිකම නිසා ගොඩ අර unwanted විදියට clear sorry ඊළඟට open questions වලින් පටන් අරන් close questions වලට ගියා. සමහර questions අහනේම නිකන් මිස්සත් questions sure නැති ගතියක් වගේ තිබ්බා. සමහර තැන්වල hesitations තිබ්බා. ඊළඟට කතා කරන ස්ටයිල් එකේ politeness එක respectfulness එක ඒක හොඳටම තිබුණා. හැබැයි ඕකේ කියන respond එක වැඩි. throbbing pain එකට ඊට පස්සේ මොනවද කම්පැනි කරන්න කියලා කිව්වා ඔය හැම එකටම ඕකේ කියන respond එක තමයි commonly ඔයගෙන් ආවේ. නේද? සාමාන්‍ය throbbing pain එකක් හරි මොකක් හරි තියනවා කියලා කිව්වම ඒකට ටිකක් වාක්‍යකින් දෙකකින් respond එකක් දෙන්න පුළුවන් but just okay summarize කරා understanding එක check කරා thank කරා ඉතින් ඒ දේවල් ටික හොඳයි එතකොට marks දුන්නකොට linguistic criteria ඔක්කොටම criteria ඔක්කොටම 4 ගන්න 3 ගන්න දක්වනු ආව එතකොට linguistic ඔක්කොටම 12යි full marks clinical communications වලට 1 2 3 4 5 කියලා අපි categories පහ ගත්තොත් එහෙම relationship building 3 ඊට පස්සේ patient perspective understand කරගන්න එකට ලකුණු 2යි structure provide කරන එකට ලකුණු 1යි information gather කරන part එකට ලකුණු 2යි ඊට පස්සේ information giving part එකට just only 1 marks all together it was 9 so ඔක්කොම ලකුණු 21යි C එකක් තමයි මිස් තියෙන්නේ ඊට පස්සේ මිස් රත්නායක මිස් get what contractions අඩුයි. ඒ කියන්නේ කතා කරන භාෂාව නෙමෙයි අර so clearව ලියන භාෂාව කතා කරනවා වගේ එකක් දෙනවා. ඒ නිසා emphasize කරා සමහර words සමහර තැන්වල නමුත් ගොඩක් තැන්වල නෑ vocabulary එක ටිකක් හොඳයි mitigate කියන word එක වගේ ලස්සන words පාවිච්චි කරා. ඊට පස්සේ repeated some answers which means clarify කරා කියන එකයි මම කියන අදහස් ගන්නේ ඒක clarify කරන එක හොඳයි ඒකට patient මොනවාද කිව්වම ආවා මේක නේද කිව්වේ කියලා clarify කරන්නේ so that's good ඒක හොඳයි ඊළඟට respond sometimes සමහර වෙලාවට respond එක හරි නෑ කියන්නේ එහෙම වගේ අර පොඩි එහෙම respond එකක් වෙලාවල් තිබ්බ summarize කරා understanding එක check කරා ඔන්න ඔය දේවල් තමයි මම ලියලා තියෙන්නේ. ඉතින් මිස්කෙත් linguistic criteria ඔක්කොම 3/3 යන්නේ. එතකොට ඔක්කොම 12 වෙනවා full marks ටික. ඊට පස්සේ clinical ගියාම relationship building එකට 3 ඊට පස්සේ second එක patient perspective understand කරගන්න එකට ලකුණු 2යි. ඊට පස්සේ structure provide කරන එකට ලකුණු 2යි ඉතුරු දෙකටම ලකුණු 1 ගානේ තමයි දීලා තියෙන්නේ ලකුණු 21යි සම්පූර්ණයෙන්ම ආපහුත් C එකක් අපි කියන්නේ C minus කියලා C plus නෙමෙයි මේ මම C කියලා කියන්නේ C minus එකට but ඒක කියලා ඔයාලා ගන්න මේක C plus නෙමෙයි C plus ඔයාලා ඉන්නේ categories දෙකකට පල්ලෙහායි දැන් ඔයාලා මේක C plus වලට update කරගන්න ඕනේ C plus වලට ගියන්න ඕනේ ඊට පස්සේ B එකට යන්න ඕනේ right ඊට පස්සේ මිස් ඉමල්කා ගොඩක් වෙලාවට මිස්ගේ කතාවේ hesitations තිබුණා repeated වෙන ගතියක් තිබ්බ හැබැයි vocabulary එක හොඳයි summarize කරා stress කරා සමහර තැන් sorry මේ මෙන්න මේක කිව්වා ඒක අර මේ අපි කියනවා මොකද leading question එකක් කියලා stressfulද කියලා අහන question එක ඒක patient ගේ කටින් යන්න නැතුව ඔයාම ඒක කියන එක පොඩ්ඩක් එතන පොඩි ප්‍රශ්නයක් වුණා. ඒ අරෙන්න ඉතුරු දේවල් ටික අසන්න තිබුණා. So linguistic criterias වලට full marks 14. ඒක මම කියන්නම් intelligibility 3, fluency 4. ඊට පස්සේ appropriateness එක 3 තියෙනවා but grammar එක above 4 so altogether it was 14 and clinical ගියාවහම relationship එක හොඳයි 3 තියෙනවා ඊට පස්සේ understanding the patient to structure provide කරන එකට one signposting words අනම් මනම් ඒව නෑ ඊට පස්සේ gather information asking questions that is good so I gave 2 marks and information giving no just only 1 mark so altogether it was 9 and altogether 23 which is equal to a C which C minus actually so 24 වුණා නම් තමයි ඒක C plus වෙන්නේ ඊළඟට මේ සුදේශා variations තිබුණා hesitations තිබ්බ නැත්තේ නැහැ right. සමහර තැන්වල emphasize වුණා මදි ගතියක් තිබ්බ variations තිබ්බ කියන්නේ ලස්සනට අර කතා කරන තැන් උස් පහත් වුණා. නමුත් තව emphasize කරන්න ඕන තැන්වල ආවනම් හොඳයි. permission එයා ඔයාගේ respond එක අර question patient ගෙන් එන නෑ. ඔව් patient ගෙන් එන respond එකට ඔයාගෙන් ආපු respond එක okay. ගොඩක් වෙලාවට need to be more empathetic. ඒ කියන්නේ less empathetic. ඒ කියන්නේ එයාව තේරුම් ගන්න patient තේරුම් ගත්තා. එයාව understand කරා කියලා පෙන්වන්න තව ඔයා පෙන්වන්න ඕනේ. එතකොට තමයි empathetic කියන category එක approach කරා වෙන්නේ. so ඒකට ලකුණු ටිකක් අඩු වෙනවා. summarize කරා එක පාඩම ඔයාලට තියෙන migraine කියලා කිව්වා. අර E4 එක නැත්තම් අපි කියන understand patient ගේ කලින් knowledge එක check කරන්නේ නැතුව. එතකොට ඔයාගේ marks linguistic criteria වලට 2 3 3 3 තියෙන්නේ. intelligibility 2 ඊට පස්සේ අනිත් තුනටම fluency appropriateness ඒ කියන්නේ vocabulary grammar ඔක්කොම 3 තියෙනවා. එතකොට all together 11 වෙනවා. එතන marks ටික clinical වුණාම relation building 3 patient perspective understand කරගන්න එක 2 providing structure just only 1 mark information giving 2 marks information gathering 1 mark altogether it was 20 equals to C or C minus C එකක් හරි ඊළඟට මිස් පතිරණගේ එයාගෙත් ගොඩාක් අර read කරනවා වගේ එකක් තමයි මට තේරුනේ කියන්නේ කියවනවා වගේ එකක් කතා කරන්නේ නැතුව මොකද අර variations නැහැ ඔක්කොම එකම level එකේ නිකන් හරිම slow කතා කරන එකේ ඒ කියන්නේ slow කියලා කියන්නේ තව චුට්ටක් speed කරන්න කතා කරන එක නැත්තම් ඔය ඉවර කරන්න බැරි වෙනවා පොඩි part එකක් cover කරන්න පුළුවන් වෙන්නේ ඊට පස්සේ less empathetic okay කියන response එක තමයි commonly ඊට පස්සේ දැන් ඔයාලා මේ කම්පැනි කරනවද කියලා අහපුවාම ඔයාලා examples දෙන්න ඕනේ dizziness ද vomiting ද මොනවා හරි තියනවද කියලා මොකද patient තේරෙන්නේ නැහැ සමහරක් වෙලාවට කියන්නේ නිසා ඒක options දෙන්න මිස්ටේ options දුන්නේ නැහැ ඊට පස්සේ stressful අර කියන leading question එකත් මිස් චුට්ටක් පාවිච්චි කරා ඒ නිසා මම ලකුණු ටික අඩු කරා මිස්කෙත් පළවෙනි part එක linguistic එකට 3/3 යන්නේ එතකොට 12 තියෙනවා all together linguistic වලට clinical වලට ගියාපුවාම 3 for the relationship building, 2 for the patient perspective, 1 for the structure, 2 for information gathering, and 1 for information giving. Altogether 21 equals to C. ඊළඟට ඉෂානි අනුරාධි මිස් හිටියා. එයාගේ emphasize pronunciation එක හරිම ලස්සනයි. calm voice එකක් හරි clear understand කරගන්න. empathetic explain කරා, clarify කරා. හැබැයි මිස් කරපු එක දේවල් දෙකක් තමයි. එකපාර questions දෙකක් ඇහුවා. occupation එකයි කොච්චර hours ගාණක් වැඩ කරනවද කියලා 2 questions එකපාර අහන්න එපා කොයි වෙලාවකවත්. අන්න එතන සහ E4 කියන්නේ patient මොනවද දන්නේ කියලා අහන්න නැතුව එකපාරට migraine කියලා explain කරන්න ගියා. so ඒක චුටි අඩුපාඩුවක්. ඒ ටික තමයි මිස් උනේ. ඊට පස්සේ linguistic criteria 5 intelligibility 5 for the fluency 4 for the appropriateness and 5 for the grammar and expression altogether it was 19 and 3 for the relationship building 2 for understanding the patient's perspective and 2 for the structure 3 for gathering information and 2 for the information giving it was all 31 which is equal to a B C plus level එක කියලා මිස් හිතා ගන්න. තව අර වැරදි ටිකක් නොකර ඉස්සරහට යන්න try කරන්න. ඊළඟට ඊට පස්සේ මිස් රංජනී එයාගේ මම මෙහෙම එකක් දැක්කා. පොඩි careless ගතියක් වගේ කතා කරද්දී. ඒ කියන්නේ too slow කොහොමද ඒක කියන්නේ නිකන් අර slowly පොලි යන්නේ නිකන් ලතාවට වගේ ඒ කියන්නේ අර හිතලාද නැත්තම් චූටි පාට් එකක් cover කරෙත් ඉතින් ඊට වඩා ටිකක් ඉක්මනින් කතා කරන්න ඕනේ ටිකක් අර මොකද්ද කියන්නේ පොඩි live ගතියක් පොඩි energetic ගතියක් voice එකේ තිබ්බ මදි hesitations උත් ගොඩක් තිබ්බා අන්න එහෙම දේවල් ටිකක් මම මිස්කෙන් දැක්කා ඉතින් මම මිස්ගේ මාක්ස් දුන්නේ linguistic criterias ඔක්කොටම 2 දුන්නේ 2 by 2 එතකොට ඔක්කොම 8 ඊට පස්සේ clinical communication පැත්තට ආවහම relation building 3 එක okay but perspective understanding එකට 2 දුන්නේ 1 for structure 2 for asking questions and 1 for gathering and so all was 9 and altogether it was 17 C එකක්. මේක මිස් හිතන්න D එකට සරියක් ළඟයි කියලා. මොකද 16 කියලා කියන්නේ D එක. 17 කියන්නේ C. එතකොට තමන්ගේ වැටමායිමේ තියෙන එකත් පොඩ්ඩක් කන්සර්න් කරලා බලන්න. ඒ පැත්තට ඒ පැත්තට යනවද මේ පැත්තට තව වැඩිපුර ගන්නවද කියලා. ඊට පස්සේ මිස් උදේශිකා හිටියේ. right එයාගෙත් introduction thank ඊට පස්සේ clarify summarize කරපු ඒවා open questions වලින් පස්සේ අර questions වලට ගියේවා ගොඩක් දුරට හොඳයි මිස්ගේ මේ කතාව ඒ නිසා මම marks දුන්නේ මේ විදිහට intelligibility 4 and 5 for fluency appropriateness 4 and 5 for the grammar so altogether it's 18 for linguistic and for the clinical 3 for the relationship 3 for the patient perspective understanding and 2 for providing structure and other 2 අනිත් දෙකටත් දෙක දෙක එතකොට ඔක්කොම 12යි ඔක්කොම ලකුණු 30කට ආවා එතකොට B එකක් තමයි එන්නේ එතකොට B දැන් තමන්ගේ එහා පැත්තේ තියෙන C+ එක C+ B කියන එකේ තමයි ඔයා ඉන්නේ එතකොට පොඩ්ඩක් කන්සර්න් කරන්න හොඳට ප්‍රැක්ටිස් කරන්න B එකේම තමන්ම රඳව ගන්න අන්තිමට කතා කරේ මිස් වර්ණ කුලසූරිය එතකොට මිසොත් කිය අර පොඩ අර මං කියන ඩ්‍රමටික් ගතිය නිකන් අර හිතලා ඩ්‍රමටික් විදියට නිකන් නාට්‍යානුසාරයෙන් කතා කරන ගතියක් වගේ එකක් මට තේරුණා සමහර තැන්වල සමහර තැන් හොඳයි අර එම්පතටික් වෙන එක OIC වගේ ක්ලරිෆයි කරන එක prior knowledge එක check කරා මිග්‍රේන් ගැන දන්නවද කියලා. හැබැයි ඒක I will explain later කියලා කිව්වා. ඒක I will explain later. අර ඒ වගේ අන්න එහෙම එකක් කිව්වා. එහෙම කියන්න බෑ. will explain later නෙමෙයි මිග්‍රේන් දන්නේ නැත්තම් මිග්‍රේන් කියන්නේ මොකක්ද කියන එක සුට්ටක් කියන්න ඕනේ. පොඩි අයිඩියා එකක් දෙන්න. හරි right එහෙම ගත්තාම මිස්ගේ ලකුණු ගත්තාම linguistic වලට 3 for intelligibility 4 for the fluency 4 දුන්න මම මොකද කතා කරා අර පොඩි එහෙම ගතියක් තිබ්බට අනිත් එකට 3 දුන්නේ so together it was 13 and clinical වලට relationship building 3 1 for the patient perspective understanding අනිත් තුනටම දෙක එතකොට ඔක්කොම 10යි එතන මුළු ලකුණු 23යි which is equal to a C right ඔනොහොම තමයි ඒගොල්ලන්ගේ marks ටික right ඔන්න last week එකේ කරන්න බැරි වුණ කට්ටියටත් අපි අද chance එකක් දුන්නා right දැන් ගොඩක් අහලා තිබ්බනේ ගොඩක් නෙමෙයි එකෙක් අහලා තිබ්බා අපිට දෙන්න නැද්ද transcript එක කියලා ඊයේ අහලා තිබ්බා මම ඒගොල්ලන්ට answer එකකුත් දුන්නා ඊයේ අපි listening class එකේදී ඉතින් අපි කතා වුණානේ දැන් අපි ටික යන්න ඕනේ transcript බලන්න නැතුව අපිට answer කරන්න පුළුවන්ද කියලා බලන level එකට නේද? ඒ නිසා ඒකට start කරන්න ඕන නිසා අපි අද අලුත් cue card එකකට තමයි යන්නේ. අපි චුට්ටක් කතා කරලා ඊට පස්සේ mock test එකට යමු. ඉස්සෙල්ලා මට time එක දෙන්න. මේක share කරන්න screen එක. Oh, you're welcome, Miss Adeshika. Right. අපි මුකුත් කතා කරන්නේ නැතුව මම ඔයගොල්ලන්ට පෙන්නන්නම් මේ cue card එක. Yes. right cue card එක මම ඔයගලන්ට පෙන්නන්නම් මුලින්ම. එතකොට ඔයගලන් බලන්න. Yeah, you're welcome, Mrs. Shani. right. මෙන්න මේ cue card එක චුට්ටක් කියවන්න බලන්න. කියව ගන්නකො ඔයාලට ඔයාගේ තියෙන cue card එක මේක. මේක චුට්ටක් කියවන්න බලන්න මොකක් සම්බන්ධද මේ cue card එක කියලා අපි චුට්ටක් බලමු. setting එකයි ඔයාගේ scenario එකයි task එකයි බලන්න කියව ගන්න. Just to understand, we'll check whether we can understand the cue card. Right. So, what type of a cue card is this? So, here the setting is actually the GP practice.
GP practitioner.
Right. Yeah. So, you're speaking to an 18-year-old boy or a girl who are presented to the clinic yesterday complaining of generalized weakness, lethargy, and inability to do the routine work from the previous few weeks. Right. Okay. So now he or she also complained of breathlessness while climbing stairs for his or her house. Upon examination, the doctor advised a blood test which revealed that this person's hemoglobin was 8. The normal range should have to be 11. I mean, like the range have to be 11 to 16 තියෙන්න ඕනක මේ මනුස්සයාගේ තියෙන්නේ කොල්ලගේ හෝ කෙල්ලගේ තියෙන්නේ 8යි. right? දැන් මොකද කරලා තියෙන්නේ? ඩොක්ටර් සස්පෙක්ට් කරනවා මෙයාට anemia. නේද? මෙයා anemic වෙලා ඉන්නේ and has asked you to speak to the person. The patient doesn't know her test results yet. දැන් ඔයාලට මොකද්ද මෙතන කරන්න තියෙන්නේ? රිවීල් කරන්න තියෙනවා. මොකද්ද තොරතුරක්? මේ රිවීල් කරන තොරතුර happy එකක්ද? bad එකක්ද?
Bad.
Yes. Right. Yes, bad news එකක් reveal කරන්නයි තියෙන්නේ. එතකොට ඔයගොල්ලන් ඉන්න profession එකේදී සිද්ධ වෙනවා බොහෝ දුරට මොනවා කරන්නද? Bad news patients ලට දෙන්න. ඒ කියන්නේ සමහරක් වෙලාවට නේද? තමන්ගේ relation කෙනෙක් ගැන bad news එකක් තවත් කෙනෙක්ට දෙන්න වෙන්න පුළුවන්. ඒ කියන්නේ දැන් හිතන්නකෝ patient වෙලා තියෙන පොඩි දරුවෙක් නම් අම්මට තමයි දෙන්න වෙන්නේ bad news එක. සමහර වෙලාවට patient මෙයාගේ report එකක්, blood report එකක් එහෙම නැතිනම් මොනවා හරි නේද urine test එකක් මොකක් හරි දිහා බලලා ඔයාලට සිද්ධ වෙනවා ගොඩක් වෙලාවට patient දෙන්න bad news එකක්. ඔන්න ඔය වගේ ඕගොල්ලන්ට හම්බ වෙන්න පුළුවන් සමහර ටාස්ක්. දැන් මෙන්න මේ වගේ ටාස්ක් එකකට එනකොට දැන් අපි කලින් කරපු cue card එක සමම ඕගොල්ලන්ට දැන් කියලා දීලා තියෙනනේ ස්ටෙප්ස් වගේක් මෙන්න මෙහෙම කරන්න කියලා. නේ දැන් ඔන්න ඕකට තව ටිකක් එහෙට මෙහෙට වෙන එකක් දැන් මේක. මොකද මං ඔයාලට කිව්වා කියනකොටම I said what I said, if you can remember. So these are the basic steps actually. Now sometimes according to the situation, according to the various type of the situations which are given in the cue cards, we need to change some procedures, some steps. Now here they are giving some of the task. Now basically now first of all you have to ask questions. Now here in this type of task you don't have to ask questions from the patient because why? මෙතන කොහෙදිවත් නෑ ask කියන word එකෙන් පටන් ගන්න එකක්. අහන්න නැහැ. ඔයාට දෙන්නයි තියෙන්නේ. ඔයාට explain, reassure, briefly explain බලන්න keywords ටික, function words ටික. Outline some treatment options and offer. මේ හැම තැනකදී දැන් අර question answer අහන්න ඒවා summarize කරන්න දැන් ඒ parts මොකද වෙන්නේ මේකෙන් එකෙන් අයින් වෙනවා දැන් එතකොට ඒක අපි ඔලුවට දාගන්න ඕනේ අදාළ දැන් අපි අර කලින් කරපු cue card එක අපි ඇත්තටම ඒක something related අපි ඒ steps ටික හැම පිටින්ම යනවා but මේකට එනකොට ඒක එහෙම පිටින්ම touch වෙන්නේ නැහැ මේකට අදාළව වෙන්නේ ගොඩක් වෙලාවට මොකද්ද සමහර දැන් මේක ඇත්තටම දැන් ඔයගොල්ලන්ට මතක නම් එක එක cue cards එක එක situation start කරන විදිය නැත්තම් අපිට දීලා තියෙන මොකද කියන්නේ මේක scenario එකේ විදිහට අපි මොකද කරන්න ඕනේ so we have to understand how that we have to start our conversation with our patient. If you are giving a bad news, if you are revealing a bad news for your patient, so at first chance we are not saying, oh, you came here to know the results of your blood test, yeah? Okay, so I have the report in my hand, so you have anemia. We are not saying like that exactly what we want. We are not very straightforward in these type of cases. So first of all, we have to ask some questions and we have to be like what it says, we have to have a kind of an interaction with our patient, right? Then සමහරු මේ වගේ questions වලදී what's your name? Yeah, ඔයාගේ නම මොකක්ද? ඇයි ආවේ කියන questions අහනවද? Yeah, why you came today කියලා වගේ question එකක් අහනවද? No, we are not saying like that because we already know this patient has a conversation with the doctor and now they are here and I have all the test results now and I know this person has an appointment. මොකද GP practitioner එකට යන්න බෑ appointment එකක් නැතුව. Right? GP ගාවට යන්න බෑ නේද? appointment එකක් තියෙනවා නම් appointment එකේ time එකට අදාළව ඉන්නේ කවුද? එයාට අදාළ documents මොනවද කියන එක ඔයා එතන වැඩ කරන nurse විදියට ඔයා ගාව ඔක්කොම තියෙනවා. So you know for what reason they are coming for you. But just to clarify who the person is, you can ask the name. Just to clarify the name. So not like that it's not a kind of a strange person for you. You already know the details of the person. So that's the main thing that it comes to your mind when you're dealing with these type of situations. So that's why you need to go through the setting, right? So going into the different type of settings, you need to understand how that you're going to start your conversation. You got it? Right. So first of all, there have to be a kind of a conversation that goes on with you and your patient for what they have come today. right? මොකටද ඔයාට මෙහෙම තිබ්බ නේද එකක් නේද? බ්ලඩ් එකක් ගත්තා නේද? රිපෝට් එකක් ගත්තා නේද? කොහොමද? Likewise friendly එකක් එතන යන්න ඕනේ. Right? මම දැන් මේ transcript උකුත් දෙන්න නැතුව ඔයගොල්ලන්ට මම මේ කියන්නේ. Then after that we have to go for the other task. Right. මේකම නැතත් මේකම නෙමෙයි මම වෙන පොඩි වීඩියෝ ක්ලිප් එකක් ඔයගොල්ලන්ට පෙන්නන්න යන්නේ කොහොමද ඒගොල්ලෝ එතනදී reveal කරන්න කියලා bad news එකක් අපි චුට්ටක් බලලා ඉමු කොහොමද යාලා ඒ bad news එක reveal කරන්න කියලා ඔයාලට පොඩි example එකක් but මේ exactlyම මේ cue card එක නෙමෙයි but අපි බලමු okay right going to share my screen and watch this carefully.
Hi everyone, welcome to OET 369. My name is Asha.
And my name is Donna.
Today we are here with another role play which most of our candidates have requested and that is to reveal bad news to one of the patients. So in this situation, the nurse has to say that this particular patient has cancer and the nurse also has to discuss the treatment options available for that patient. Okay, so today Donna will act as an oncology specialist nurse and myself will act as the patient. So let's go and have a look how that goes.
Good morning.
Good morning.
My name is Donna. I'm one of the oncology specialist nurses here to help you. We've recently received your results and they seem slightly unsettling. We have identified a tumor, but it's primary, so it can be cured. It can be helped with other sources of treatment such as chemotherapy. How are you feeling?
I'm really worried about this. When you said that, well, I didn't expect these kinds of results, so it's really bothering me. And you've said that we've got the treatment, but I'm still worried. Can you explain what is that?
I can understand how you're feeling because this is quite of a large, heavy news for you to receive. But I can assure you that the treatment that we're offering, such as chemotherapy and other forms of treatment, if you are interested, do guarantee a good chance of survival and recovery. So you should not be worried, and the good news is that we have identified this at its early stage. So it won't grow or affect you in any other ways.
Okay. Well, so you said that we've got this chemotherapy as the treatment option, but may I know what are the other treatments that I can have?
There is surgery and there is radiotherapy and many sources of treatment like that, but After looking and studying and analysing your records and your information, I really believe, as a specialist myself, that chemotherapy is the best treatment.
Okay, but I'm so worried about this chemotherapy because I have watched in television and I've read many in the internet, and like this chemotherapy is really harmful for us and they can destroy our cells. And I have also read that I may have hair loss, and that's something I don't really want to. And do you think I should go for this?
Those symptoms are normal. Everyone who undergoes chemotherapy do experiences those kind of symptoms and vomiting. It depends on the person, but it's because of it's such an intensive treatment. But in the long term, it's all about your health and your recovery. So even though there are side effects and horrible symptoms, it's worth it, if you understand what I'm saying.
Well, I do get what you mean. Okay, right. So can you guarantee a curable option, like will I be cured out from this chemotherapy?
In most cases, recovery is promised because it's specialized individuals who are doing this, and we've conducted this kind of treatment with a lot of patients and most of them have recovered. So I do assure you that most likely you are likely to recover.
Okay. All right then. Is it possible to discuss it with my family? Because you can imagine how hard this is for me, and I would really like to discuss this with family before I take a decision.
Of course, because this is a person-centered service. You can tell anyone you'd like, as long as it's up to you and that you're comfortable in disclosing your personal information.
Oh, right. Okay. So I may probably tell my parents and my husband and see what they think about it. So is it possible to talk to you when they come?
Of course. You need to discuss these kind of treatment options with your family and take their opinions as well. But all I'm telling you is not to worry, because I've already booked a blood test for you next week and we'll get those results back and then we can move on to further steps.
Okay.
Yeah.
I think I should just take this positively and face it, isn't it? So I'm so glad that you've explained me in detail about these treatment options. So if you believe that chemotherapy is best for me, then I think I should just give it a try. Why not? Right. Okay. So I'm probably in touch when my parents and my husband come. Okay. Thank you so much for your help today.
No problem. But also, I would like to assure you that it looks like a scary journey, but there are many specialists and professionals here designed just to help you. And I can even refer you to a community nurse to help you with the side effects that you may experience. So you're not alone.
Okay, that's great. And that's really reassuring. I just feel much comfortable after speaking to you. Thank you so much.
No problem.
So guys, in this situation, donor was revealing that this patient has cancer, and she's also discussed the treatment options available. So if you just listen to the phrases Donna used here, so she have said like most of the cases it is reassuring. So that is the terms that you can use when you reassure a patient. Tell to them these are the common side effects. That is another term. So just try and normalize the situation. And one of the important points Donna has made here is that you are not alone, which made me think that I'm not alone. So that is how you should deal with a role play card. Okay, so guys.
Right, okay, so that was actually the end of that video clip. So I'm going to ask a question from you. So now that you have watched the video clip as well, now you would have realized what sort of things that we have to emphasize here in these type of cue cards. දැන් අර අපි කලින් කතා කරපු cue cards වල ගොඩාක් දේවල් අපි mix up වුණාට now when it comes for especially when you're revealing a bad news and exactly what it happens here is, now if you're revealing a bad news for a patient, which means the patient is diagnosed with a kind of a condition or a disease or something. නේ යට මොකක් හරි ලෙඩක් මොකක් හරි condition worse එකක් තියෙනවා කියන එකනේ. අර bad news එකක් වෙන්නේ ඒකනේ. ඒක නරක news එකක් වෙන්නේ ඒකනේ. යට මොකක් හරි අසනීපයක් තියෙනවා කියන එක. So always in these type of cue cards, we have to reassure our patients. Yes, එතකොට මේ වගේ conversations වල වැඩිපුරම ඔයා reassure කරන්න පාවිච්චි කරන්න ඕන phrases වැඩිපුර දැනන් ඉන්න ඕනේ. ඔයාලා දන්න එකම reassuring part okay I can understand කියන එක විතරයි නම් මේකෙදි මේ වගේ conversation එකක් යනකොට කියන්න වෙන එකම phrase එක oh yes I can understand what you're saying I'm really sorry ඔය ටික විතරයි නම් කියන්නේ එතනින් එහාට අපිට ය아가න්න බැරි නම් මොකද වෙන්නේ රිපීට් කරනවා same line එක. එතකොට ඔයාලා එකම තැන තමයි යන්නේ. ඒක හරියන්නේ නැහැ. ඒ නිසා pre-assure කරන phrases ගොඩාක් ඕගොල්ලන් දැනගන්න ඕනේ. ගොඩක් කියන්නේ අඩු ගානේ 6ක්වත් විදි ටිකක් මං කියන්නේ reassure කරන්න patient. මොකද over and over යාට reassure කරන්න වෙනවා. ඊළඟට තමයි persuade කරන්න තියෙන හැකියාව. යම් දෙයකට පොළඹවන්න. treatment options වෙන්න පුළුවන් යාට ඊළඟ දේ තමයි මේ වගේ තැනකදී කතා කරනකොට අපි ගහගන්න වගේ කොහොමවත් අපි කතා කරන්නේ නැහනේ අර calm voice එකක් යාව නිවෙන patient නිවන්න පුළුවන් අර calm clear voice එකකින් එයාව තේරුම් ගන්න එයාව understand කරගන්න එහෙම නැත්නම් යාට respectful කරන voice එකකින් ඔයාලා කතා කරන්න ඕනේ voice එක නෙමෙයි අතන මම කියන්නේ tone එක ගැන right එක tones තියෙනවානේ. ඒතකොට ඒ tone එකට ඔයගොල්ලන් එක switch කරගන්න ඕනේ. යාව තේරුම් ගන්න එයා ගොඩක් questions අහන්න පුළුවන් වාගේ. අරක මොකද මට මොනවද මේකට කරන්න පුළුවන්? එයා බය වෙලා ඉන්නේ නේද? මේ වගේ දෙයක් කිව්වම ඇනීමියා කියලා අමුතු නමක් කියලා කිව්වම දන්නේ නැහැ මොකක්ද ලෙඩේ කියලා. සමහර මේක බොහොම easily treatable එකක් තමයි. නමුත් patient දන්නේ නැහැ නේක එයා ගොඩක් බය වෙනවා. ඒකට ඔයාගේ වැඩේ තමයි ඔයා calm වෙලා එයාව ස්ටේබල් කරන එක. ඒතර මේ වගේ තැන්වල bad news එකක් reveal කරන්න ආවොත් cue card එකකට ඔයාලා reassuring part එක, ඔයාගේ tone එක, එතකොට ඔයා කතා කරන විදිහ නේ, ඒ කියන්නේ tone එකත් කියලා කියන්නේ. එතකොට explain කරනකොට ගොඩක් වෙලාවට treatment options ගැන explanation part එක වැඩිපුර තියෙනවා මේකේ. ඔයාට කතා කරන්න සිද්ධ වෙන තැන ගොඩක් බැරි patient වඩා. එතකොට explain කරනකොට මොනවද අපි පාවිච්චි කරන්න ඕනේ? හෝගාලා අර මාකල දිගාරිය වගේ කියවගෙන ගියොත් එහෙම patient තේරෙන්නේ නැහැ. එතකොට අර උගලන්න මතකයි providing structure කියන එකේ signposting words. So first signposting words use කළා කඩන්න පුළුවන් කැලි වලට. පොඩි කැලි වලට කඩන්න පුළුවන් මොනවා හරි explain කරනකොට. දැන් hemoglobin level එක low වෙනකොට තමයි anemia කියන එක එන්නේ කියන එක ඔයා explain කරන්න ඕනේ. ඔයාගේ hemoglobin අපි check කරා. ඔයාට මෙන්න මේ weakness අනම්මනම් තිබ්බ නිසා අපි මේක check කරා. ඒ check කරනකොට තමයි මේක මුනේ කියලා අර flow එක තියෙනවනේ. දැන් දන්න දේවල් මේවා. ඒ flow එක ඒ විදිහට ලස්සනට මෙයාට explain කරලා ඒ explain කරන part එකේ කඩ තමයි explain කරන්න ඕනේ. පොඩ. එයාට තේරුණාද කියලා check understanding. එතකොට මේකෙදි ඔයාලට marks හම්බ වෙන්නේ understand කරගන්න පුළුවන්ද? ඔයාගේ voice එක කොහොමද පාවිච්චි කරන්නේ? chunks වලට කඩනවද? carry වලට කඩනවද? දැන් ඒක ගොඩක් කට්ටියගේ කරන්න බැරි වෙන්නේ. ගොඩක් දැන් අර පහුගිය එකේ නම් නේද? information giving part එකට යන්නේ නැහැ. ඒක අන්තිම හරිය තිබ්බ නිසා last එකේ දැන් ඔයා chunk වලට කඩන්න ඕනේ මේක පොඩි carry වලට. කඩලා තමයි ඔයා තියෙන්නේ. ඒක තියෙන්නේ providing structure කියන එකේ ඔයාලට මතක නැතිනම් ඒ පාස් මේකට ගොඩාක් ලකුණු අඩුවෙන් හම්බුනේ මේ අද මේ කරපු එකට. මේකේ තියෙන sequencing the interview purposefully and logically. sequence කරනවා කියන්නේ carry වලට කඩනවා. logically purposefully. purpose අනුව carry වලට කඩනවා. carry වලට කඩලා තමයි explain කරන්නේ. ඒතර එහෙම කතා කරනකොට signposting words පාවිච්චි කරනවා topics කැඩෙනකොට. ඊට පස්සේ using organizing techniques in explanation. මොනවද organization techniques? Categorization, chunking, repetition and summary of important points. සමහර points අපිට repeat කරන්න පුළුවන් explain කරනකොට. Right? ඔයාට මතකද මම කියපු දේවල් ටික? Can you remember what I told about the treatment options? Just to mention again, we have like these treatment options for this one. And if you have understood, so if you have any concerns about it, you can ask any question about that. Or if not, we can move on to the next step. අපිට ඊළඟ step එකට යන්න පුළුවන් ඔයාට ඔක්කොම තේරුණා නම්. අන්න ඒ වගේ ආගේ අන්ඩර්ස්ටෑන්ඩ් එක චෙක් කරලා නේද? අලුතෙන් ඒකම පොයින්ට් එක හරි කමන්නේ දෙපාරක් හරි එක්ස්ප්ලেইন කරලා අන්න ඒ දේවල් ටික වැඩිපුර තියෙන්න ඕනේ මේ Q කාඩ් එක කරනකොට. දැන් මම එකපාරට Q කාඩ් එක ආන්සර් කරන්න කියලා කිව්වොත් එහෙම අපිට අමාරුයිනේ. ඒකයි මම මේ ඉම්පෝටන්ට් දේවල් ටික ඔයගොල්ලන්ට මෙන්ෂන් කරන්නේ අනිවාර්යයෙන්ම තියෙන්න ඕන දේවල් ටික. එතකොට establishing initially what already patients know explain කරන එකනේ තියෙන්නේ. ඒතර අර ඩෝංගල් explain කරන්නේ නැහැ. ඔය දන්නවද anemia කියන්නේ මොකද? Have you ever heard the term anemia? Right? So, okay, so that's not a problem. So then I can explain it from A to Z. So ඒ විදිහට එයාව මේ කතාවට අල්ලගන්න පුළුවන්. right? එතකොට ඒ දේවල් තමයි මේකේ වැඩිපුර තියෙන්න ඕනේ. එතකොට ඔයාලට මේ වගේ කන්වර්සේෂන් එක අන්තිමට පුළුවන් සමරයිස් කරන්න මොනවද අපි අද කතා කරේ මෙන්න මේ දේවල් ටික. රෝගේ බ්ලඩ් එකේ මේ ටෙස්ට් එකේ තිබුණා මෙහෙම දේවල් කියලා ඔයාලට කතා කරන්න පුළුවන්. right? So do you have any questions to answer from me now? මේ සම්බන්ධව තව මොනවා හරි දෙයක් අහන්න තියෙනවද? right මෙන්න මේ ටියුට් එක මම ඔයාලට දෙනවා ඇත්තටම මේකේ මේ ටියුට් එකේ මුලම මෙන්ෂන් කරලා තියෙනවා මම treatment and advice ඒ කියන්නේ ගොඩක් වෙලාවට breaking news දෙනකොට අපි breaking news කියන්නේ bad news එකක් හරි මොකක් හරි information එකක් දෙනකොට ගොඩක් වෙලාවට අපිට ඒත් එක්කම එනවා treatment options කියන advice අපිට දෙන්න වෙනවා patient ට. ඒතර ඒ දේවල් වලට පොඩි examples ටිකක් මම මේ ටියුට් එකේ attach කරා. right? So there are many things you can do to relieve arthritic pain. Arthritic pain, for example, doing light exercises 30 minutes a day will be helpful for you. And also, I recommend reducing alcohol consumption. So, what do you think about that? Harry, it's a good idea to check your daughter's temperature because this condition can cause fever. And if you find any other symptoms such as nausea, vomiting, or diarrhea, then please contact your local doctor. That's the best thing that you can do. Likewise, අපිට ගොඩක් වෙලාවට මේ වගේ තැන්වලදී treatment options එහෙම නැතිනම් මොනාරි advice එකක් දෙන්නවා. එතකොට අන්න ඒ වගේ අවස්ථාවල පාවිච්චි කරන්න ඕනේ කොහොමද අපේ vocabulary එක කියලා explain කරලා තියෙන ඔන්න ඔය පළවෙනි set එකේ. හරිද? ඊළඟට ගොඩක් වෙලාවට අපි පාවිච්චි කරන්න ඕනේ positive language එකක්. positive language කියලා කියන්නේ මොකද්ද? අම්බෝ ඕක මාර අමාරු ලෙඩක් ඕක හැදිච්චෙන් 7-8ක් මැරුණා මේ වෝඩ් එකේදීම අනේ මන්ද මාර ලෙඩක් තමයි එහෙම කියලා පේෂන්ට්ස්ලාට අපි කිව්වොත් එයාලා බය වෙනවනේ ඒ නිසා මොකද අපි හැම වෙලේම පොසිටිව් වලට කතා කරන්න ඕනේ මෙතනදී මොකද ඔයා හොඳ හැබැයි බොරු ප්‍රවෘත්ති දෙන්නේ කිසි දෙයකට බය වෙන්න එපා මේ අපි හොඳ කරලාමයි ආව යවන්නේ එහෙම අපිට බොරු ප්‍රවෘත්ති දෙන්න බෑනේ සෝ මෙන්න මේ වගේ දේවල් අපිට එක්ස්ප්ලেইন කරන්න පුළුවන් මෙන්න මෙතනදී So that's a good question, Joan, and I'll explain it to you now. Munaharia Ahudi. I'm glad you asked, and let me explain the treatment procedure. Treatment procedures in Anivare Megadi Mevage Tangwara Dihana. The staff are here very experienced and will take care of your daughter. Right? But the nurses here are very experienced with looking after children and they'll make sure your daughter is comfortable. Whether a daughter with a or comfortable, balagana, kisi dekada can buy venepa, on the treatment options up to then Napulankinega. So I have many patients who have taken this medication with good results. So I recommend same for you. Okay. So the surgeons at this hospital are very experienced with this procedure. So you don't need to worry too much. They'll take care of you. And take care of you. You're in good hands. But I know it sounds difficult at first. I know it sounds a bit difficult at first, but with practice, I'm sure you'll be able to administer the medication by yourself. Then මේ වගේ sentence එකක් කියනකොට මේ meaning එක එන විදිහට තමයි කියන්න ඕනේ. කවුරු හරි කෙනෙක් නිකාම කොලයක් බලාගෙන කතා කරොත් එහෙම mock test එකකට හරි ඇවිල්ලා I know it sounds difficult at first, but with practice, I'm sure you will be able to administer the medication by yourself. කිසිම තේරුමක් ඔලුවට යන්නේ නැහනේ. නේ? ඔක කියන්න ඕනේ මේ මනුස්සයාට දැනෙන විදියට. මුලදී ටිකක් අමාරුයි වගේ තේරෙයි. නමුත් ටික ටික කරගෙන යනකොට ඒක අවුලක් වෙන එකක් නැහැ. ඉතින් ඔයාලට කරගෙන යන්න පුළුවන් වෙයි. අර ඒක ඒ මීනින් එක දෙන්න ඕනේ සෙන්ටෙන්ස් එක. ඒතර ඒක කතා කරන්නම ඕනේ ඔයාලා. ඒක මීනින් එක දෙන්න. So many of my patients have attended the quit smoking program, and as a result, I've been able to quit smoking successfully. I'm sure it can help you as well. Help you as well. So after your shower, you'll be feel much better. Likewise, so positive language use කරන්න ඕනේ හැම වෙලේම patients ට මෙන්න මේ වගේ situations වලදී ළඟට ගොඩක් වෙලාවට දැන් සමහර වෙලාවට අපිට advice දෙන්න වෙනවා සමහර වෙලාවට ඒගොල්ලන්ට persuade කරන්න සිද්ධ වෙනවා exercise කරන්න smoking alcohol cut කරන්න ඊට පස්සේ ඒගොල්ලන්ට nutritional foods ගන්න encourage කරන්න. එතකොට එක පාටම patient කැමැත්තක් දෙන්නේ නැති වෙලාවල් තියෙනවා. reluctant patients ලා ඉන්නවනේ. ඒ වගේ තැන්වලදී මොකද කරන්නේ? explain කරන්න ඕනේ risk එක. නේද? ඔයා මේක කරේ නැත්නම් ඔයාට මොකක්ද වෙන්නේ? So it's a common condition and it's treatable, and with the right treatment we can reduce the risk of any serious complications and your son will make a complete recovery. risk එක explain කරන්න වෙනවා සමහර තැන්වල. තුන ඒවට අදාළ කරන සමහර prices තමයි මම මෙන්න මෙතන attach කරලා තියෙන්නේ. Right? එතකොට breaking bad news පොඩි examples දෙක තුනකුත් මම මේක attach කරා කොයි වගේද අපි ඒක කරන්න ඕනේ කියලා. එතකොට ඒ වගේ මොකද කියන්නේ bad news එකක් දෙනකොට මොන වගේ විදිහටද අපි අපේ introduction එක ගන්න ඕනේ කියලා තමයි මෙන්න මෙතනදි කියන්නේ. මොකදක් වෙලාවට අපි greet කරන්න ඕනේ. ඊළඟට ඔයාව introduce කරන්න ඕනේ. ඊට පස්සේ අපි ගොඩක් වෙලාවට refer කරනවනේ යම් දෙයකට. මොකද්ද? lab එකේ report එකට අනුව. නැත්නම් මොකක් හරි conversation එකක් අනුව. නැත්නම් CT scan එක අනුව නේද? මොකක් හරි අර මම කිව්වර introduction එක අපි ගන්න ඕනේ මේකට අනුව. මොකද මේකට bad news එකක් reveal කරන්න කලින් ඊට කලින් මොකක් හරි conversation එකක් තිබ්බනේ. අවස්ථාවක් situation එකක්. ඒක අපි මෙතනට ගන්න ඕනේ start කරන්න. Hari, so nice to see you again. Thanks for coming in today to review your lab and biopsy reports. Is there anyone in the waiting room today whom you want to remain present with you when we discuss your reports? Likewise, hari right. Warm up with the patient. So symptoms gonna how are your symptoms? Like, right? Hari. Well, your test results are back and it seems that the news is not good. අපි conversation එක start කරන්න එපා දිගටම ඇදලා ඉන්න බෑනේ. අර විදිය start එක නැතුව මෙන්න මේ line එක ඉස්සල්ලාම කියන්නේ නැහැ. That's what I want to tell. මේක ඉස්සල්ලාම කියලා නෙමෙයි start කරන්නේ. අර අනිත් දේවල් ටික කලින් කියලා නේද? සම්බන්ධතාවයේ connection එක build up කරගෙන then you're saying that it's not good. Right? ඒකට තමයි ඊට පස්සේ එමද reveal කරගන්න. Unfortunately, I'm concerned about the biopsy report and it has revealed that you have the මෙන්න මේ ටික use කරන්න පුළුවන් ඕගලන්ට මොනවාද? reveal කරන්න news එක. right ඊළඟට මෙන්න මෙහෙම මම ඕ කියලා දාලා තියෙනවා. ඉතින් ඔයාලට මේක කියව ගන්න පුළුවන්. මම ඔක්කොම කියවන්න ඕන නැති වෙයි කියලා හිතනවා. right ඊට පස්සේ explaining positive, discuss about operation, chemotherapy and radiotherapy, palliative therapy. වගේ එක තියෙනවනේ එක දේවල් ඔයගොල්ලෝ ඔයාලා ඒ දේවල් ගැන ගොඩක් දන්නවනේ. එතකොට ඒ දේවල් explain කරන්න පුළුවන්. සාකියු කාඩ් එකේ දීලා තියෙනවනේ ඔයාලට මොනවද කියන්න ඕනේ කියලා guide එකක් දෙනවා. ඒ guide එකට අනුව ඔයගොල්ලන්ට කතා කරන්න පුළුවන්. right ඊළඟට convince for the treatment given with the reassurance. So reassure කරන විදි ටිකක් මම මේ tube එකකට attach කරා. So මොන්න මේ විදිහට strongly I'm also hoping for the best results. Because anyone might have the same reaction, but it's the best option for you. So if you're suggesting chemotherapy for a patient sometimes most of the time, not sometimes, most of the time they may get like shocked, right? Because it's common to see many of the side effects of chemotherapy, but in that cases you need to explain the risk of not doing that, and also you have to say you have to emphasize the benefits of doing chemotherapy or some other type of treatments for the patients just to convince them to do the treatments. Okay, right. These are the things that you are usually doing in the hospital with the patients, but just I'm telling the same thing have to be done here in the exam as well. Okay, right. And then red flags. ඒ කියන්නේ ඒකත් risk එකක් දෙන එකක් තමයි. මේක කරේ නැත්නම් මුළු body එකට මේක spread වෙන්න පුළුවන්. නේ නැත්නම් යා convince වෙන්නේ නැහනේ. ඒක ඊට පස්සේ reveal. තව මොනවා හරි දෙයක් උදව්වට දෙනවද? එහෙම නැතිනම් මොනවා හරි leaflet හරි මොනවා හරිද? If given in the task review එකක් කරන්න ඕනේ. දීලා තියෙනවා නම් විතරයි නැත්නම් කරන්න ඕනේ නැහැ ඉතින්. මෙන්න මේ වගේ දේවල්. ඉතින් මේ ටියුට් එක මම ඔයාලට එවන්නම්. ඒව පුහාම ඔය දේවල් ටික ගැන ඕගොල්ලන්ට බලන්න පුළුවන්. හරි. So is there anyone who has a question? මොනවා හරි අපහැදිලි තැනක් තියනවද කාට හරි අහන්න? Right. Hands up කරලා තියෙන නිසා ගොඩක් අය hands up කරලා දිනවා raise hand කරලා තියෙනවා. මේ වගේ cue card එකකට දැන් පොඩි අදහසක් ආව එකේ තව විනාඩි 5කුත් තියෙන එකේ මම කැමතියි එක්කෙනෙක්ගෙන් තමයි ගන්න මෙන්න mock test එක මම කැමතියි මේ සිරේෂා හර්ෂනීත් එක්ක mock test එකක් කරන්න if you like.
Yes, I like.
Yes, you like it. Okay, miss, you can start now.
Hello, good morning. I'm Harshini. You are attending us here today. What do you prefer to be called?
Call me Sachi, please.
Thank you, Miss Sachi. How may I assist you today?
So I'm having an appointment today just to discuss the results of my report.
Yes. Yes, definitely. I have today morning. We got your test reports and I will discuss. And the first things I want to share with the results with you, and then we can discuss the causes and treatment for you. Is that okay with you?
Okay, so I don't know what it mentioned in the reports, but if you're talking about the treatment options, I don't know what it is about actually. So if you can tell me what's there in my reports.
Don't worry, Miss Sachi, I will tell you. Okay. Your test for your hemoglobin for hemoglobin normal level is between 11 to 16, and however your level was found to be 8.
Oh, is that so? It's so low.
But don't worry, Miss Sachi. Based on your reports, doctor said you are suffering from anemia, which means having a low hemoglobin, as you said.
Anemia. I've never heard that. What's that called, anemia? Is it some kind of treatable disease? I know nothing about that, please.
Yes, I know. I know, Sachi. It must be your willing to hear this. But let me reassure you that your condition is normal. It is a common condition and it is easily treatable, Miss Sachi. So don't worry about that. Let me explain about the anemia.
Yeah, please.
Yes. Before that, I would like to know about your prior knowledge about the anemia.
No, I don't know. I know nothing about anemia. I've never heard that term. So I'm just worried.
Okay.
So when you suddenly say that I have anemia and I know nothing about that.
Okay, don't worry, Miss Sachi, but I will explain it to you. I know anemia is not enough hemoglobin in your blood. So these cells are essential for carrying oxygen around your body. Is this okay too?
Yeah, which means that you're saying that there's no enough hemoglobin in my blood, and so that causes anemia. So, uh, okay.
Don't worry, Miss Sachi. With your correct medications and correct treatments, you can get cure this problem. So don't worry about that.
Mm-hmm.
And next, I would like to talk about your treatment options.
Mm-hmm.
It is okay with you?
Yeah, sure. Right. Okay,
Yes,
thank you, Miss
sure.
Iresha. Thank you, Miss Iresha. Yes, as per the time, yes, you did an amazing job actually. Right. So in these type of situations, sometimes we get panic or nervous sometimes. So you have to get ready to answer for these type of questions without the transcript. That's why I said it, because now here, so first of all, Miss Iresha, you asked why I came to you, right? So that's not the thing, that's not something that we are not in doing here in these type of conversations, because as I said before, you already know for
Yes.
what reason the patient is coming, okay? So we're not asking how can I help you like that. We don't ask
Miss,
any of that because you know for what reason
yes.
the patient is coming, okay?
Yes.
That's the first
Firstly,
thing.
Miss,
Yeah.
firstly, we can ask. I would like to go with your blood reports today, likewise.
Of course, that is the
Yes.
best start, actually.
Okay.
Yes.
Mm.
And although always
And
you can
also,
ask about the
yes,
symptoms. How about the symptoms? I know that you were complaining about the lethargic, and so how was those symptoms? Ne? ඒවා දැන් කොහොමද කියන එක?
yes. And
Uh,
also, can I ask about, as I understood from your case note, yesterday you are complaining, you was complaining of generalized
Very
weakness,
good,
likewise.
Yuresha, miss. Yes, of course, you can say that. Like, yes, you have to refer to something and tell, and yes, you have to let the patient know that you already know the patient. And now for the examiner, actually, yes, for the examiner that you're showing the examiner that you already know, you have understood this setting and you are into this setting. තනිකරම මේ setting එක understand කරගෙන ඉන්නේ. And so you by reading the situation, you have understood you are I mean, like, you have understood there's a prior connection, a prior conversation that has had with the patient. So to show that, you have to get start like that. So if you're starting like why you came today like that, so it doesn't show that. Okay, that's why. And the next thing is you outline. Yeah, outlining your conversation is good, but now here, before saying, now you haven't said that what is the bad news, right? You haven't said the results. Now, without saying the bad news, without saying the test report, you're saying that, okay, so first of all, we're going to discuss about the report, and then I'm going to say the treatment options. So එතකොට patient panic වෙනවා. මොකද්ද මට වෙලා තියෙන්නේ? මොකද එයා එකපාරට treatment option එකක් ගැන කියනවා. So, if you're outlining your conversation, right, it's better to do it before revealing the bad news. When you start your explanation, so then you can say, you got it, Miss Iresha?
Yes.
Yes, and there were some hesitations as well. And also, I will explain about the anemia, right? So, අර වෙච්ච දේත් එක්ක I already said that I didn't know it. I don't know anything about anemia. And then after that, you again asked, do you know anemia? So, එතන පොඩි පරස්පර දෙයක් සිද්ධ වුණා. අර සිද්ධ වෙච්ච outline එකත් හින්දා. Right? Okay. So, and also that was repeated. Yeah, okay. So you have to be consider about these facts when you are dealing with the cue card. So this is what it happens if we didn't get used to do cue cards on the spot. අපි හැමදාම cue card එකයි transcript එකයි අරගෙන මේකයි සිද්ධ වෙන්නේ කියලා ඔළුවට දාගෙනම answer කරන්න ගියොත් අපි කවදාවත් අර on the spot එකකට යන්නේ නැති වෙන්න පුළුවන්. ඒතර එක පාට මේ වගේ එකක් දුන්නාම අර ටික එන්න ඕනේ. දැන් මම ඇත්තටම දැන් ඕකත් කලින් චුට්ටක් කියලානේ දැන් මේ විසිරේෂට මේ වෙච්ච දේ විතරක් නෙමෙයි මම මේ කියන්නේ. මේක විසිරේෂ විතරක් නෙමෙයි වෙන කවුරු කතා කරත් ඕක තමයි වෙන්නේ. අපි පැනික් වෙනවා. අපිට අන්ඩර්ස්ටෑන්ඩ් කරගන්න වෙනවා මොකද්ද අපි කියන්න ඕනේ කොහොමද ස්ටාර්ට් කරන්න ඕනේ. ඒ නිසා පුළුවන් තරම් cue cards අරගෙන ස්ටාර්ට් කරන්න, කතා කරන්න, try කරන්න, වීඩියෝස් බලන්න ඕන තරම් YouTube එකේ තියෙනවා. අද රයිසන් කරපු නෑ මං එහෙම කරන්න කිව්වොත් ඒක හරියන්නේ නැහැ මොකද මම දැන් Q card එක දීලත් නෑනේ මම ඕගොල්ලන්ට next week එකේ chance එක දෙන්නම් ඕගොල්ලන් next week රයිසන් කරන පිළිවෙලටම මම අරගෙන යන්නම් හැබැයි next week එකේ රයිසන් කරලා මට ගන්න බැරි වෙලා තිබ්බොත් ටෙස්ට් එක මං ඒගොල්ලන්ට ඔන්න ප්‍රයොරිටි දෙනවා ඊළඟ වීක් එකේ එහෙම අපි යමු මොකද දැන් අද ඉන්න කට්ටිය දැන් මේක අලුත් එකක් නේ එතකොට එහෙම කරන්න කිව්වොත් එහෙම ඒක හරි නැති නිසා but next week එකේ ඔයගොල්ලන් raise hand කරන එකත් එක්ක හැබැයි මම මේ tute එක next week එකේ තමයි ඔයගොල්ලන්ගෙන් speaking ඒ කියන්නේ mock test එක ගන්නෙ එතකම් මම try කරා මේ tute එකේ ඉතුරු කොටස් ටික ඒ කියන්නේ මම අර මුලින් පෙන්නපු parts ටික විතරක් හරිය ඔයගොල්ලන්ට send කරන්න මේ part එක නැතුව cue card එක සහ ඉතුරු ට්‍රාන්ස්ක්‍රිප්ට් එක නැතුව ඉතුරු ටික එවන්න. ඒත් ඔයගොල්ලන්ට ඒ ටිකවත් බලාගෙන රෙඩි වෙන්න පුළුවන් නේ. එහෙම කරමු අපි. and හෙට ලිස්නින් ක්ලාස් එක තියෙන ඔයගොල්ලන්ට ආපහු ඒකට එන්න. එහෙනම් හෙට හම්බ වෙන එකන් හැමෝටම good night.